and ask that we approve the consent agenda.
Make a motion to approve the consent agenda.
Can we get a second? Okay, David is motion, Janet seconded it. Let's go ahead and take a quick vote on it. We're going to do this just because John has given me forms for individual votes. Let's do it individually. So, I, David.
Aye.
Okay. We don't have it. Yeah. Okay, Barbara.
Yay.
Okay, Tanya. Tanya's not with us. Chris.
Aye.
Aye. Daisy. Here. Okay, you can eye on that one. And Janet. Aye. Aye. Okay. So that passes. Then we need to approve the minutes from the last. Let's do that quick roll call vote. Aye, David. Okay, aye, David. Not here yet. Barbara.
Yay.
Criminal director.
John is not
You should
here.
know.
Chris.
John will look up
Yes.
for.
Yes.
And Daisy.
We've lost transmission altogether. Can't hear.
Ruth is on the call. Ruth, can you hear us?
We can hear you, Scott, but we can't hear anyone else.
Can you hear me now?
I wonder if you're muted. Are you
I just unmuted.
you're unmuted? Can you hear Bill now?
Yes.
Yeah.
Say
okay.
something else, Bill. Yeah,
You can hear?
Yeah,
Okay.
I'm here now.
yeah.
And Emily is joined us now also. Emily, real quickly, are you okay with the consent agenda? Okay, and the meeting minutes from last week? Thank you. Okay. So let's jump into Clay, I'm sorry, so we Clay, we've got to.
Ruth is here.
Okay.
Okay. Are you asking for the Friends report now?
Yeah, just a quick transcript.
Okay, I'm having difficulty hearing because there's so much echoing in the room where you are. Actually, we don't have very much to report. We don't have any activities going on. We are expecting to have a meeting first week of August. We decided not to meet for July. And that is all I have to report.
Okay, thank you. Carl, do you have anything on the foundation, library foundation?
I'd be happy to. Can you all hear me?
Yes.
Yeah.
Okay. I missed the meeting last month, and I know that Scott gave you a little bit of information on our June board meeting, which is the foundation sort of annual meeting. I wanted to add to what I saw in his minutes that we did vote for one new member. Every June is when we hold, we do nominations and take a vote for new members. Holly Freeman, the executive director of the Math Science and Innovation Center, is our one new board member. And our chair has stayed the same, Trevor Cox. Our vice chair or our vice president is John Olmschneider coming this fall. So those are the two changes we made to our board membership. And the only other big thing that we did was we created, I know I told you guys in June that we were doing a lot of work in our financial committee. cleaning up and doing work on our investment portfolio and our procedures to make our portfolio, frankly, more resilient, considering the sort of strange place the markets are in these days and potential volatility still. We made a lot of changes to that. We created some new policies and procedures, and we also created a new endowed fund, which we're calling the Centennial Fund. You guys are going to hear more about this later, but we have merged a few small funds and added some other monies into it. And it's called the Centennial Fund because we're getting prepared for the 100th anniversary of the library. And we want to have a fundraising campaign, a vehicle to use for that. And for the foundation, it'll be called the Centennial Fund. And it'll be a fund that every year the Library Foundation will make a gift to Scott and the library, to all of you, for the purchase of books, materials, and other things for the library. So you guys will hear more about that. It's going to be a fund that everyone will be able to make donations to. It currently has about $35,000 in it, and that's how we've established it, but we certainly hope to add a lot more to it over the next couple of years. So that's about it for me.
Thanks, Maren, that's great. Okay, moving on to Scott, and Scott, I know since you're gonna have to leave pretty, we need to keep things going. Do you, listen, I'm far enough away, I think, I'm safe to take this off in a minute, to be heard. Do we want to, as part of your report, go ahead and go into some of these decision makings and issues, do we want to hold that for your business?
I can do it.
Let's do it.
Yeah, I can do it under my report and give you guys a general update, more of which is in my director's report that you received this month. Can everybody hear me okay? Is the feedback okay? Okay, good. So the big thing that's been going on is that we reopened the libraries on July 6th. It seems like it's been ages ago. So things were going pretty well until Friday, the 17th. We had a staff member who was exposed to a confirmed case of COVID at our North Avenue branch. And subsequently, when that happens, you have to kind of investigate and then have the person go and get tested and go into quarantine when you have a confirmed exposure. So when we had that staff member basically works with all of the other staff at that branch. So they were also exposed to the person who was our community police officer who was visiting the branch on their rounds around the neighborhood. So what we did was we closed the location. We are doing some extra cleaning, and staff went and got tested. The Virginia Department of Health protocol for this is that this is how you proceed, and then the person who has the potential exposure gets tested, and then they have to get tested again 10 or 14 days later to confirm that they do or do not have the COVID exposure. So that's where we're sitting right now. So that happened on Friday. Then Tuesday, we had the same situation happen at the Whole Street Library. A staff member who's a part-time employee and also works at the Henrico County Public Library worked with two people who had confirmed COVID. They were confirmed to have the COVID virus. She worked with them when they were symptomatic. And so she was contact traced and told to go and get tested. She reported to work at Hull Street that morning and worked with her coworkers for 2 hours. And so in return, they have to get tested. So that's usually the protocol. There's like VDH has guidelines on how that exposure takes place. Our locations are so small that it's pretty obvious that you run a risk of having exposure. That's again why we're all wearing masks and protecting each other. So we've closed those locations. We're going to keep them closed for the next 2 weeks. And then as soon as we can restore our staff, then we can reopen in whatever format we can do after this discussion here. So one of the in general, we opened and it's been kind of scary for the staff. We're getting feedback from patrons that they have concerns, but we also have people that are using the library. I'm going to share with you a circulation report that'll kind of give you an idea of what the circulation is looking like. And I want to also let you know that we let the community know that we closed those locations because of a COVID-19 exposure. So that went up on our website and we are posting signs on the door.
Right.
So it's important for us to share that. I don't want to spread fear, uncertainty, and doubt in the community, but we have to be transparent when it comes to those situations. So that's what's taken place so far to deal with North Avenue and Hull Street. Any questions on that so far? Any comments?
Scott, so this is actually circulation. I'm a little confused.
Hold on, let me share my screen so everybody else can see it.
Okay.
I can't see it any longer, Scott.
Yeah, I'm trying to bring it up. I'm trying to find the right one.
So Scott, as you bring, there it is. So let me ask, so the 71375 numbers were curbside circulation?
Right, so July 1st through July 6th, those are the numbers that we have for curbside. Can everybody see it now?
Yes,
Yeah.
yes.
Okay.
Yeah.
So this is day by branch, and you can see what those daily counts are. Our total for the month so far is 17,600. And then down below, I can give you a comparison to 17, 18, 19. So those were times when we were completely open.
Right.
One of the challenges right now with any of the data that we're getting is it's all skewed because of this crisis. So
Right.
door counts, computer counts, circulation counts are all goofed up. So that was one of the things you all asked me to provide you last month, is when we made the adjustments to the hours, was kind of this feedback. So circulation is probably one of the indicators that I can most rely on and show you, and it's the most solid number. I did ask our branch managers to send me their feedback and reports about what they're seeing, and they've given me some samples of days there and just issues that have come up. So at this point, I'll stop for a moment and see what questions you all have.
So let me ask you this, Scott.
Hold on. David, I'm not sure what you're referring to. What part? Okay, July 19. Right, so North Avenue was closed and Hull Street closed right away. Ginter Park, I don't know what happened with their numbers, or East End. I don't know. I just got for this meeting. Oh, is it Sunday? Okay. So it's Sunday. That would explain some of that.
So Scott,
Sometimes people check in the wrong date. Sometimes the computer isn't set right. Sometimes there's errors like that. I'm not 100% sure. I can look into it, but you know, it's just yeah.
so Scott, did you find any surprises to your plan? You had talked about having the computers separated, social distancing, mass distribution. Did that part go as you expected it to?
We have had some instances with people refusing to wear masks. I've had a person who complained pretty vociferously because they said they had a health issue. And we said, well, we can't allow anyone in we don't want to allow anybody in the building without a mask. And so if you have a health issue, what can we do for you outside? I can bring you a book, or I can get you an
That's
information
gracious,
need
yeah.
out here. And she wanted to use the computer to work on something. Well, I can't allow somebody to come in the building without a mask for an extended period of time and do that sort of thing. So that we recommended she get help, or if she could wear a mask. She refused, so I couldn't give her service. And
Well, I'm
the key
happy
thing
you
is-
only had one. Yeah.
Well, we've had others. I mean, so I told you I asked staff to give me their feedback on
Yeah.
what's been happening in their locations, and I have reports from each of them. We're seeing low computer usage because people just aren't coming in. Downtown here at Maine, our busiest day is Monday. Things used to be busy throughout the day, but what we're seeing is because no one's working downtown, so the state's not here, all the employees who occupy these towers are not here right now. So they're not coming in on their lunch hour to pick up books, or they're not picking up books on the way home.
Right.
We're also
Right.
not doing any programs, so we're not seeing lots of people coming in the building. We've had, so we've had people make requests for meeting rooms and things, but we can't provide those because we just can't provide them. The
Okay.
things that have been successful are like the things that we were doing before. So we've created these STEAM kits, which are team book kits, and they have craft hours in them. So they're like take-home activities. Those have really just taken off. So people are picking
Whoa.
those up
Good.
and using them.
Great.
That's right.
Let me give you an example. So last Saturday at Maine, we had 96 people walk through the door, and we were open from 10 to 5. So far, since we opened on July 6th, we've had 2,000 people come to Maine. On an average month at Maine, if we look at the board report, so last year for July, we had, I can't give you a good number. So July of last year, we had 16,000 people come in. So that was 31 days. This is however many days we're open right now. So we're still, it's not happening.
Yeah.
A lot of people
Yeah. Well, I
coming
think that's to be expected.
It is.
in.
What about notarizing? It was something we talked about last month, and we were all comfortable with not allowing people to have documents notarized. Has that proven to be a non-issue? Did nobody ask for anything to be notarized?
No, we've had people ask for notarizations. It's just we really can't do it. I can't say
Yeah. No, I think that's the right decision.
it's a huge demand.
Yeah.
We've had a lot of people ask for printing and faxing. That's happened a lot, especially our North Avenue branch and some of our other branches. Now that we're open, yeah, we're offering fax service. So they can hand us a fax and we can send a fax. That's a high demand thing, especially for people who need to send in paychecks and things like that. Let's see.
On the door count activity, I mean, it's obviously, Maine isn't insignificant, but it's low.
Right.
80, but 1% there.
Right.
How are the branches on that? I mean, are they seeing?
So at East End yesterday, their door count was 157. They had 27 PC users, and they were open from 10 a.m. to 7 p.m. They sold 1 earbud. They did 18 print jobs. They did 4 faxes and 5 requests for notary service. So people are requesting notary service. At West End, their circulation in July of 2019 was 11,712. In July this year, they've circulated 3,884. They're probably one of our highest circling branches, and you can see how much they're trailing. PC usage last year at West End was 754. This year it's 184. Door count last year at West End was 5,102, and so far it's 1,440. That's open from July 6th to the present. So you can see we're running at about 20 to 25% of what we
Right.
usually run.
Right.
Westover Hills, for instance, on July 16th, they had 48 patron visits. They circulated 91 items. They gave out 3 masks to patrons who came in without. They reminded 2 patrons to keep wearing their masks correctly. They had 2 patrons leave the building. They had 2 phone calls asking about curbside service. They had 6 children visit. 2 did not wear masks and needed help locating items, but had a difficult time maintaining appropriate distance from staff assisting them. 1 patron on the computer needed more one-on-one assistance than staff could supply, and they reminded that we just cannot get within 6 feet. So that, the thing is, people need kind of computer assistance because they have such low computer skills, but staff can't provide it. So what we're saying is, hey, if you need that level of help, you need to bring help with you. They had 1 person who was in literal tears about having to come in and get their library and asked to pass on a request to curbside service. So we have some patrons who are afraid to come in the building. We have some that are coming in the building. It's been pretty much, this has been the case across the system. Ginter Park, their patron count last year was 9138. This year it's 1,144. Their circulation in July of last year was 4,381, and their circ so far is 736 for July. Oh, I'm sorry, that was June. That was when we were in curbside. Computer usage last year was 1,082 at Ginter Park, and this year they've been at 245. So,
one thing, let me ask if I'm reading this, just to quickly have this document and looking at it. It seems like curbside things obviously picked up for nothing since we were closed, but a lot of people did curbside. But when we actually opened branches, particularly West End, but also Ginter Park, we really bumped up the circulation dramatically versus curbside. About 10 to 20% of circulation. During curbside, we were running at more like under 5%. So we more than doubled, probably quadrupled with being open. Is that?
yeah.
Okay, just checking.
And I can only speculate as to what the factors are that are driving that. I'm guessing that it's because we're open and that is helpful. I think our advertising has been fairly limited, but we have promoted this as much as we can in as many places as we can. So
the question I'm asking, really, I guess I'm working around to is, with the limited staff, when we have something like North Avenue has to be shut down, we can clean it pretty quickly, but we don't have staff to go in and run it while we're waiting for the people to go through their 2-week period. Okay. So, I think Scott has suggested that we need to look at and say, do we go back to curbside across the board? Some people like it and have asked for it and would prefer it. Others obviously are more comfortable coming in and looking. Circulation went up dramatically, not to where, it has been, but pretty dramatically when you open up the branches. So I guess I'm looking and saying, so what are people thinking about? Scott's wondering whether we should go to just curbside because that reduces the risk for staff being out for 2 weeks at a time while they're being tested and quarantining, and nobody there to handle it. So the issue is, if we have to shut down a branch, we don't really have anyone who can go in and do curbside probably at that time. Is that right, Scott?
Right.
So we have the option maybe of saying we go back to curbside and we can keep everybody open. It's highly unlikely that we'll have to close the branch, in the curbside environment. You might lose some workers, but you lose, fewer of them at a time at least. On the other hand, we have people who are clearly more comfortable coming in. So what are people's thoughts on how we might approach this? Do we look at rolling back completely to curbside? Do we look at some type of shift in hours and say, we're going to have it open for people who really want to come in for a limited time? Do we make curbside open for a limited time as opposed to 9 hours a day of curbside? which is an issue. Do we go back and revisit the courier delivery option? And if so, do we do that across the board? Do we do that externally? Do we do it internally with people? Do we consider doing that just for a certain percentage of our population of users who are at risk, the elderly, comorbidities, et cetera? And if so, how do we do that? So those are just some questions that I've been thinking about. I spoke with David as our vice chair for another month or so here. Spoke with David about that, and he had some of the same questions. And I thought we'd throw it open. Let's all talk about what people think we should do. Is that we at that point, Scott? Do you have anything else you wanted to add to that?
I mean, those are the options. I mean, the way I see it.
Scott, you're muted. Scott, you're muted.
Right, so I'm gonna unmute, so other folks will mute, so we have less feedback. So our options are, we can remain doing what we're doing and face the challenges of having these exposures and shutting branches down and recovering from that incident and trying to restore service. When we have opened to the general public, it takes about twice as many people to run a location operationally than it does to run curbside. So one of the challenges has been we can't split shift things. So I can't have like an A and a B shift working at a location. And that's what's happened at North Avenue and Hull Street, is because I have to have more people in the space. I have to pull their staff in and they have to be working. So if somebody gets sick, it takes everybody out. I also don't have a full roster of staff. So I don't have fallback people that I can send over there to run the location. And it's difficult to get temporary people to even come in and run. So that's what we're faced with in the current situation. With curbside, we can deliver the traditional library services we've delivered, books and resources. We can answer reference questions remotely, electronically, through email, through telephone, through chat. If people have information need, we can do that. We've learned a lot from curbside, so we can offer printing services and faxing services. People can fax those to us or can email them to us or drop them off, and we can print or fax. So many of the things that we can do in the space, we can do through curbside. It's just, I don't have the capacity to run both at this time,
Right,
curbside
right,
and an open thing.
right,
That would
right,
probably
right.
be the ideal situation, especially if we were a little bit further along and we weren't having these exposures. The exposures just really throw a wrench into our operations. Another option is we could close down completely. I don't want to do that, but I have to mention that. So I think those, we could also try and do, we've looked at like, maybe we do curbside at all the branches and we open up Main and have Main be open where we can socially distance and maintain space. Those are all, that's another consideration. We can do a mixed bag. We could open some branches to regular service and curbside service. So those are about 4 different options. I think we mentioned other levels of service. We've looked at like, so we've really investigated like delivery options. I wish there was an Uber Eats that would deliver our books. We can't get a big vendor like that to take us. I think that would be a cool concept if we could have an app and that could work. Grubhub, those sorts of things. Those are really expensive platforms to implement.
They are.
We looked at RVA, Quickness RVA as a bicycle delivery service. They kind of operate in the area here. It's a very cool concept. They were willing to work with us. The problem is they have a very small service area and it doesn't reach a majority of the city. So that is probably the barrier with that. And then we don't know how we would pay for it. Like, is that a cost that we pass on the consumer? Do we have it act like a pizza? So like you call up and say, I want my book, I'm gonna be here, I'll deliver it between 1 and 3. I check that out to you, you have to be there to receive it. So there's been like many wrinkles with the delivery system that we would find like partnering. So that's kind of wrinkles that we've had to those things. So those are kind of the options that we're presented with. I mean, most importantly, I want to keep everybody safe. So keeping our patrons safe and our staff safe. The response that we had to take into this exposure was just really a challenge. I am hopeful that those staff who have been had to go into quarantine are going to be fine. So far, all of them have been coming back with negative tests, and I anticipate the rest of them coming back with negative tests because our staff has been really doing a great job of practicing the 3 major things: wearing a mask, washing your hands, keeping your distance. The challenge has been the patrons who come into the space because, again, we don't know where they are. They don't necessarily keep their distance. They don't necessarily keep their mask on. We don't know what's going on with them if they're sick or having a fever. That's what's caused this exposure to our staff who've had other jobs or have been in the space.
Right.
So that's where we're at. I think we need to have like a dynamic response to this, similar to what the schools have done. I mean, they've said like, we're going to go back to virtual for 9 weeks and we're going to assess in 9 weeks where we're at. You know, if we get this curve lowered to the point where it's less than 50 cases for our area, I think we won't have these exposures.
Right. Right.
So that's where we're sitting. What questions do you have? So I'll stop there.
Scott, what's the sense that you've gotten from staff generally? Do they feel concerned about having 2 exposures at branches in such a short period of time? Or do they feel like what they're doing now is safe? Do they feel safe at work, or have you gotten feedback?
So we have a lot. Again, we have a lot of staff who have those factors that are comorbidity factors. So they have a lot of fear. We have answered those fears and tried to provide every form of PPE that we can. You'll notice we've got the plexi screens, we've got the gloves, we've got the masks, we've got the sanitizer, we've got multiple masks. We're handing masks to patrons. And for the most part, I would say 95% of our patrons are compliant. They're wearing masks. We're trying to get adjusted to helping people as much as we can. We want to sit down next to them and help them on the computer, but we just can't. And patrons get frustrated and upset because that's what we used to do. We just can't do that at this time. So in general, I think staff want to work, they want to be here, but they have fear, just like I think we all do. And I think we're all feeling it wherever we go. So I think that's the sense I'm getting from staff. That's what they're relaying to me. We're giving them everything we can, but I still don't know if that's enough. I think their greatest fear is that they're going to get it here and take it home. And so we've had 2 instances where people have been exposed to it because they're here. And that is a problem. And I don't know I can put all the protection in place. And I was hoping that we wouldn't have these circumstances, but I've had 2 in a week. So it gives us pause, and I think we need to make a good call on this.
Well, I have a question, Scott. My question was, I'm sorry. My concern was, all right, looking at 2 branches being affected the way that it has happened is kind of reality of just what it's like to try to work around a virus when you have so many people coming in that are not in your circle, or you don't know where they have been prior to coming to your space or your facility, and then they're inside and they may be there for periods of time. With having vacancies in some of the branches, if we went back to the curbside, doing curbside, and then the staff providing some of those other services, that we could maybe make it known that, how you can get in touch with the librarian, not necessarily that you can come inside, but how could you get in touch with the librarian? Because, the thing I was concerned about is the libraries serve so many purposes outside of just patrons getting books, getting films, researching. I mean, it is really a home base for a lot of people. And when I think when the library has that kind of mission, it's very difficult. It's very difficult in these times. But if you're looking at just curbside, what would that do to your staffing patterns? Would we be in a position that you could still keep all the people you have, or would that mean that we would be looking at having to let some people go, because would they still be needed in the same way? I guess, would that be an impact?
Well, what it would do is it would allow us to split our shifts, so we could have some redundancy and purpose, and we'd be able to operate in a more distant relationship. That would be a safety factor. Janet brought up that we've only been open 2.5 weeks, and I wanted her to finish what she was saying.
The point is that there have been 2 instances already. So I don't want to sound like I want the library to stay open when it's not safe, but it's 2 weeks. Like before you open, did you discuss what would be the trigger to close it?
Jen, I think you're muted. Can't hear you over this.
We can't hear her.
Bottom
Can you
left.
just repeat what she said?
Yeah, she's doing that now.
Am I on yet?
Yes.
Mhm.
Should I say that again, or
Yeah.
does it
please.
even matter?
Yeah, sure, Matt. Yeah.
So my question about the 2 weeks, that we've been open for 2 weeks, and there have been 2 instances, and the staff are rightfully concerned. So is it enough time to know that it's time to step back? I mean, and I asked Scott, before you opened, did you talk about what would trigger closing the library again?
Yeah, let me jump in for a second too, Dan, because I been wrestling with some of the same. I think I am here. I am here. Stay, I guess. Okay, so let me jump in just for a second. I've shared a lot of Janet's question about that, thinking in 2 weeks, we've had 2 exposures, and if this continues, are we going to have a problem, or is this an unusual situation? Is 2 weeks enough to tell? And frankly, one of my thoughts on this is that from the safety of our staff, I suspect that those 2 exposures are, a fraction of the ones that they have gotten with going to the grocery store, doing the other things that they're doing in their day-to-day life. It's just that we're doing a better job of contact tracing to the libraries and things like that. That we know who was here, the police officer who rotated through North Avenue. So I don't know that we're at all in an inherently more dangerous situation for those people. The police officer who rotated through at North Avenue wasn't there for a long time. He wasn't a 2 hours sitting at a computer, exposure to the librarians, et cetera. So I don't want to be nonchalant about that exposure. But I do think, Janet, you're right that 2 weeks isn't enough. I'm concerned that from a protocol perspective, we are going to get a lot of these because of the closeness that we have and the contact tracing. People know they went to the library at this time, as opposed to saying, well, here, the 200 people I passed in Kroger in the time that I was there. So anybody who's been at the library knows they've been to the library, and we know that our staff has been there. We haven't notified any of the patrons who were there during that time. So it hasn't gone to that level of contact tracing. Is that correct, Scott? Right. So I'm saying, it's an inexact science, obviously, and everyone's just doing the best we can on that. But we're going to hit these situations because of the contact tracing that even with a lot of false alarms, we're going to be closing a lot, is the concern, right, Scott? I mean, it's obviously a concern for safety, but I think it's a bigger concern for staffing, that we're going to hit times where we've had, 3 in a row at North Avenue, and now it's been closed for, 6 out of the last 9 weeks, if we go with this pattern, is my concern. With the staying open. At the same time, Scott's getting ready to run to something, and the mayor's office called him concerned, why were we closed, particularly with yesterday, because of the heat and so on. They're worried about it, and that's particularly true here at Maine. It's true at some of the other branches. But while we're not a cooling station for the city, and we're not part of social services, the city does sort of want to be able to direct people, and they'll go with it if we're closed. They'll understand that. But that's an issue. So we have the access to books, we have the other, aspects of the library, all of which are down right now as far as usage. Even the people who are coming in aren't using the computers as much, and so on. And we have the other question, which is in 6 weeks, we're going to be dealing with the schools being closed in virtually. And is that going to do more or less, create more or less need for the library? I don't know. But, as far as those students' needs. So I think we've got to look at this and keep adjusting. Maybe, Scott, as you suggested, that we can't really look at this and say for the next 3 months, this is what we're doing. This is a short window. I don't know. What do you think?
I think you described it really well, Bill, because I went back and forth. Emily asked about the staff, and I thought, yeah, the staff's a problem. Barbara talked about the services. People need fax, they need computers, they need someone that's cool if they are outside. So we have this whole cut smaller than before, but I'm going back and forth with what I would recommend.
Yeah, I think a lot of us may be finding that ambivalence right now, that there's not a clear, simple, you know, what I guess I would like to suggest that we need curbside probably. It sounds like curbside, we've got people who want to do that, and that it is our safest way as far as exposure for everyone. But that if we want to look at a hybrid, I don't think that's out of the question, that we say, okay, so maybe it's going to be open for certain hours. And if we're worried about the heat, maybe it's that we have it open from 3 o'clock till 7 o'clock, a 4-hour shift every day or something, when it's the hottest period of time. Or, you know, we look at some different issues, or, you know, 1 till 5 or whatever it is. Or maybe we even look at certain days. Do we have a group of younger librarians with less concern for comorbidities, not going home to elderly parents, et cetera, who would be willing to rotate and run, you know, North Avenue on Mondays and Belmont on Tuesdays and East End on Wednesdays? And could we have a rotation among our libraries where each branch is open 1 day a week or something with the same staff that is comfortable going out there? We don't want to have our, you know, staff at risk, but we do have, you know, some younger, healthy, without those issues, maybe as people who are less concerned and may even want to get out there. And then as far as one other thing which David brought up, he and I were talking, some of his final thoughts as vice chair, and he was suggesting that we even consider the option, since the courier service has gone through. Do we have employees in the library, and what would the legal issues be, and so on? But do we have any employees who would like to do delivery? If we had that, say we offer delivery to our 65 and older, or those with disabilities. You know, I mean, we're just trying to be creative with different ideas. So,
Bill, to expand on that a little bit, I went online before I came here, and the online Google was full of libraries that are adapting. They have to adapt. We don't know if this is going to go a year, it's going to go 6 months. We've got a game plan. We need to have a game plan. And to reach the folks that are higher risk, which you mentioned earlier, it's important we offer them something. And if we could get, some of these libraries are volunteers and they use their own vehicles, like Friends of the Library and others have made arrangements with their cities to use city vehicles. You and I talked about having one for South Side, one for North Side, but if we can identify the high risk people so they can stay at home, they have a greater sense of comfort. So yes, expand on what you were saying.
Okay.
I have a question about how we coordinate with the other departments. Like, how do we coordinate with the health department when by us having an outbreak, especially since we're a city service? What happens to the notifications? Do they come in to give us some guidance too, in terms of how to make a plan when we're dealing with such a high risk group of people?
Scott, do you want to field that one?
So the city has a COVID-19 strategic plan, and that is the plan that we're following. The protocols that we've used for these exposures are based on the Virginia Department of Health exposures, which are then based on the CDC exposures. So we're following the policy and procedures that have been established by those overarching groups. So that's how we've handled the situation. In terms, we're trying to just really practice an overabundance of safety to really ensure that our patrons and our employees are safe in trying to provide this service. So it's kind of difficult to say if there's really not one answer for every situation of these exposures, because all of them are different. And it depends on how it all happens. So I hope that answers your question.
It does. I guess because my concern is I am very concerned that, our patrons are safe, but even more importantly, that our staff is safe. And people, I think, are just frightened because there's so many unknowns. But
Correct.
the other piece of it is that because, for the mayor to be questioning the fact that the branches were closed says that somehow getting information like to the city, to the health department, because especially with this kind of heat wave we're having in the middle of the pandemic, they of course are wanting people to be able to go someplace cool. And right now there's only one place that the city is sending people, and that's to the Department of Social Services. So I'm sure they were thinking with the libraries, we could start putting that information up. So I guess.
And so we didn't stand up to be a cooling center. We wanted to let people know that we were a space that people could come in and get cool. We're not providing water or those other services around it.
Yeah.
Because, again, those places that people traditionally go when it's hot, like the movie theater or restaurants, those places aren't open. So we were just really trying to let people know that we were another place that was open for people to visit. It is very clear that is not our strategic mission to be a cooling center. So, and that's a concern too. We have the general public come in and the staff are exposed. So.
Yeah, that's true.
Okay. So my question would be, and we need to keep things rolling, and I'm not trying to cut any discussion. I want to bring anything in, but my question would be, do we have enough information today that we can make a decision that covers us for the next few weeks at least? Do we need Scott to get anything more for us? I guess my inclination is to suggest that we go back to curbside delivery. I think that's where Scott is most comfortable. Am I right about that? Okay. And that we, going back to curbside delivery, that we, over the next 10 days or less, look at options for allowing a little more in-person usage of the libraries in conjunction with that. I don't know if there's an option there available. Maybe it's certain branches. I think you can look at the door count's been very light. Probably not that big a deal if they're not open. The ones that have had the heaviest usage, we may need to look at. And maybe we, like I said, look at something, even if we rotated, the staff, as I suggested, we said, okay, so here's the staff who feels most comfortable being in the library environment right now. And we let that staff rotate from branch to branch over the course of a week. So every 5 days, have a library open. If we had 2 groups of them, could you have 2 libraries open consistently? I don't know. So Scott, what are your thoughts? What are everyone else's?
Before you talk, let me just make a suggestion. Whatever we decide, let's put a time limit on it, that we revisit it in 5 weeks, 2 weeks, 4 weeks. We can renew when we revisit it, but let's not have things be open-ended. And let's have some thought on what are the conditions where we change the policy? Is it a decrease in COVID cases in Richmond? What are the factors that are going to drive a decision? So we go into this with a substantive structure for our decisions.
Right. That's excellent. So thoughts from anyone? I'm not trying to guide this completely. Janet, you brought up some other things. What are you thinking? What would you like to suggest? If we made a decision, and I think the longest any decision we make right now is going to be till this time. Well, I think it should be a month. We do not have a meeting scheduled for August. However, we can do a quick Zoom one to either say, yeah, this is working, or we need to adjust. But I don't think we should be looking at any decision that we anticipate not affecting. Obviously, if COVID cases drop dramatically, we can look at it opening further. I'm more concerned with, if we stay open right now, do we have an issue? Do we need to temporarily close and say for the next couple of weeks or the next 4 weeks, we'll do curbside only? In doing so, we are going to annoy people who have started coming back in. we are going to see circulation drop. We're going to, and once again, our primary mission is not social services, but we are going to, for the hottest period here from mid-July to mid-August, possibly the hottest period of the summer, we will not be providing any respite from the heat for some of our users. We will have, maybe more facilities as far as being able to do the faxing and things that we weren't doing with curbside initially. So that's not a loss there. I was surprised the Wi-Fi usage during closure was remarkably low, I thought. So I don't think that's an issue that, we really need to address maybe until school starts up.
Bill, while you mentioned that, Scott, the last time we met, we mentioned having signage in the parking lots to make patrons who show up aware that that's a hot spot they can go to. Where are we on that?
So we're working on it. We are trying to determine like the best way to do that. If we say that we have to, do we need to provide a space for them to sit and do that? Some of our branches don't have places for them to sit.
No, we're talking the parking lot. There's the parking lot signs. Right.
I'm sorry, what? Not everybody else.
True.
Right, not everybody are. Some of our branches are wrong. So we are looking at that, to figure out a strategy to implement that, those lives. So we are working on it. Right, like what we're doing as a sign of like Wi-Fi,
Free Wi-Fi.
Yeah.
I mean, do we utilize our marketing circle? Is he president? So those are the things we've been talking about, and then to advertise it on the and then do we provide space for it? Because computer stuff is the one thing that
People can't get curbside. So we didn't want to just stick signs out and, just put them out to put them out. We wanted to put them out and have a strategy for how we were going to let people know what they could do. Then we get into an issue of power. How do we provide power to them? Do we come up with a scheme like we provide the Wi-Fi, you provide the power? So I just didn't want to go and stick signs up without thinking about it. So those are the things that we are working on since the last meeting.
David, is your concern that you just want people to know that our Wi-Fi is turned on even when the library is closed and go ahead and use it? Don't worry about power, don't worry about space, just let them know. I think that's sort of what you had said last time. And
Just an FYI sort of thing.
Yeah. So I don't think we want to try to get power out to there and then deal with power in the parking lots. We don't want to put up picnic tables so that people can come sit. I mean, we're not trying to change that way, are we right now? Yeah.
You had mentioned that the Wi-Fi is pretty strong signal. You said it covers the parking lot, so pretty much a good thing, right?
they do. I don't think they're they should be. That's good. If we've seen the signal, how do we do that? How do we make that work with the city's infrastructure? How do I get that in the IT? What products do we use? Those are all things that we use around the world. So those are all things we do.
Okay. Well, let's go back to our big question that we've got to decide in the next couple of minutes here, which is starting, say, tomorrow, we're going to have 9 branches minus the 2 that currently have COVID exposure issues open, as we have since the 6th of this month, or are we going to go back to curbside initially while we look at some type of hybrid, or are we going to say for the next 4 to 6 weeks, we're just going to do curbside, period?
I think it definitely needs to have a time limit on what period of time we're talking about. Because I just think that because there's probably going to need to be a justification for why we're closing and what's the criteria for us to reopen it, to reopen the branches.
Thanks, Emily.
Yeah, and I don't know that any of us are ready to come up with a criteria for reopening branches right now. If we were to close them, I mean, I don't know what that number has to be as far as declining COVID cases, increasing ones. I mean, what happened at North Avenue? What happened at Hull Street? That could happen when we have 5 cases a day being reported or 500 cases a day. The chances of it go up, obviously, but we're not going to be out of this for the next 6 months as far as,
No.
the risk. I don't believe. So we're going to have to figure out, what level of risk are we willing to take? What level of risk are our patrons willing to take? And what level of risk is our staff willing to take? Sounds
Right.
to me like our patrons have been good about mask wearing. We're not checking temperature, but if any given library has a concern about that, I don't see any issue why we couldn't get some temperature guns and actually do that. Although we all know that temperature is not as big an indicator as they thought initially. So, I think we can protect our staff a lot, but in the short term, do we need to, while there's apparently, I mean, my concern is just, do we have staff if we stay open? Are we going to have a problem? I'm not really that worried that we're exposing them to a dramatic increase in risk. I could be wrong about that, but I just don't see it.
If I could just interject, I think
You're muted.
what we're seeing, I mean, in our 8
You're not
branches,
hearing me. Hold on.
can you all hear me? I'm getting a lot of sonic.
Hang on.
In any
Wait,
case,
hang on a second. Hang on, Daisy's talking, her computer's not working.
Daisy needs to unmute.
Right. Curbside. Okay. I'm gonna, could anyone hear Daisy remotely?
No.
Okay, let me real quickly paraphrase what Daisy said. She did it really well and succinctly, but Daisy's feeling is that short-term curbside should be our focus. And that she thinks we need to figure out how to do long-term with hours and everything. But that right now, it's important that we have services available everywhere with curbside, we'll make sure we can. So that's pretty much Daisy where you would say we like.
Yeah, I think we pretty much need to just have flexibility as things progress to come up with creative ideas. But what people have to do is that this decision probably can't be made. I don't have to be made. So let's have that flexibility.
So Daisy's view is that we should go ahead and go with curbside today. I'm going to just go around the here and then online. Okay, Emily's also in favor of curbside now. And I think all of this is with the idea that we revisit this with other options to expand beyond curbside, and that we do that revisiting in X number of weeks, whether it's 2 weeks or 4 weeks, we can talk about. David?
To be clear, are we talking exclusively curbside?
Yes.
Short term, I'd agree with that.
Okay. Janet? Yes. Okay, so then Chris, you're remote. And Barbara, you're remote. What are y'all's thoughts?
I definitely would be supportive of the idea of doing it remotely, but trying to make certain that we given what the time period is and we're going to re-examine it, which may mean we may have to have an August meeting, but so that we can at least say to the public that we know it's a problem, but we are constantly reviewing the data, trying to make certain that we can open and keep everyone safe.
Okay, I think that's perfect, Barbara. Chris?
I'll go this time, but I do so reluctantly because you're right, Bill. This doesn't change in the next 6 months, and we have to learn how to live with it. So yes, I vote for returning to curbside, but I don't know that I'll do it again.
Okay, I think that's where I am. I think that's where a lot of us are right now. Scott, does that give you enough to work with now? And I'm going to ask whether people think 3 weeks or 4 weeks. I think 2 weeks isn't going to give Scott and his staff enough time to come up with alternatives, other options in addition to curbside. But I don't think we should be looking at more than 4 weeks. And I'm fine if people say, let's, reconvene via Zoom in 3 weeks and look at Scott's options and make a decision from there as that changes.
Let's have Scott decide whether it's 3 or 4 weeks because he
So one of the challenges
line.
is I have to be able to make schedules and I have to give people consistent schedules. And usually we schedule out longer than 2 or 3 weeks. We're also dealing with a situation where if I have to split people into being able to manage continuity of service, I have to change my whole scheduling process if I go to open. So I need probably more time than 4 weeks to do this. And I think we need to see a significant change in how this pandemic is progressing. I think, so operationally, it will be very challenging to like flip flop back and forth from curbside to open.
Well, the other option.
That is a big problem.
To the 7th or whatever it is, whatever. You go with Labor Day. Let me say, the other option we have is to say, let's branch it open. And let's go when a library has an exposure, let's go to curbside for it. And let people come in up until we have a problem at any given branch. I mean, Scott, does that help you any on your schedule?
It probably would help on the schedule. I'm just trying to understand how I explain that to staff. So what we're saying to them is, we want you to work, and if we have another exposure, we're gonna shut down because we don't.
We're not shutting down because we're concerned over the safety. In my mind, we're shutting down because we are not going to have the staff while we're doing that testing period. Most of those shutdowns are going to turn out to be false alarms, is my belief. I mean, you're finding out what's happening right now. You know, we can't.
I don't know that you can say that.
We don't know. We don't know either way.
Well, you know what? I'm concerned that we are not, both of those cases were, it was a staff person's coworker, and then the community officer.
Right.
Emily, can you unmute so we can hear you?
You have to unmute.
Sure.
Are not hearing about.
That's very possible.
And those will be delayed compared to the confirmed staff.
Yeah.
We couldn't hear Emily's response.
Emily was bringing up the issue of, we know the exposures that came because one had a coworker who's reported and the other was a community officer, so they were easily traced back. We don't know how many patrons may be asymptomatic, not aware of exposure, et cetera, and either one of those two, and have not contacted the library to say, by the way, I was in on Thursday, and you know, I think I might have been exposed to somebody on the Wednesday before, or whatever.
All people in the libraries, when these 2.5 weeks, there's a no report of patron having come in, and I just don't believe that none of them.
Yeah.
No, you're right, but the two staff members who infected our staff members worked at Henrico. So they were Henrico library employees who this person was a confirmed contact with.
Right.
So I don't know that the case we're making gives our staff a lot of confidence that it's comfort that it's safe. I'm working from, I think we need to consider like what things can we do as safely as possible. I believe that curbside and contactless delivery of library services is safer than what we're doing right now. And in terms of that, that's where I think we need to work from. When we see the numbers decline to the point where we're not having these exposures, then I think we're in a safer place. And then we should look at expanding, turning the dial back. So turning the dial back to where we were makes sense. But I think it's difficult to expect library staff to expose themselves, and then one of their great concerns is they catch it at work and then take it home to someone else in their house who has that comorbidity even greater. I would say 90% of my staff are all people in high-risk categories. And I want to be able to provide the service, but I also don't want to put them at a high degree of risk. For me, the safest thing that I would recommend is that we shift to curbside, assess it in Labor Day 6 weeks, and then say, okay, it looks like things are going better. We'll have those options at the time. I'm not just saying we go to it and we forget about it and we just, heck with it. We're working from the premise of what can we deliver to our patrons, and I think we're doing a really great job of that. all of the electronic resources. We'll move our resources to those things that we can absolutely deliver safely. And I think our patrons will absolutely respect that decision too. We're not going to please everybody. You're going to have those patrons who are going to want to come into the space, and we have those diehards who are still coming in now. But that's kind of where we're at. And that's the difficulty of this decision, because this crisis changes almost every 6 hours, I swear.
Yeah.
I didn't anticipate that we would have exposures. I didn't see that coming, but when we had it happen, we had to respond. And I feel like this was the only option we had at the time, because again, we are tasked with trying to keep everyone safe. And I wish there was a perfect answer. I wish I could say we could put our eggs in that basket, but I can't do that.
I agree with you. I think I'm just saying.
I agree. I'm with Emily, yes.
Yeah. It needs to be made just for staffing reasons. I think my point is that I don't feel like Richmond or Virginia has a robust enough contact tracing infrastructure to say that staff are not at risk by coming to work. And I don't think that's acceptable. So I'm going to wait. And part of what we need to wait for is some goal for what community exposure in Richmond is.
Scott, you said 90% of your staff is high risk. Now, what constitutes high risk?
Age or comorbidity?
Comorbidity factors, diabetes, weight, general asthma, respiratory conditions. If they're a smoker, there are many things that impact someone's risk factors to this. And I would say most of my staff have those.
Okay, we need, Scott's got to go, so I'm going to say, let's go ahead and take a quick vote. One thing I would say is that I think it's important to recognize that the solution we're doing right now, I think we're going to all agree to do this, that it is fine for the ones at our patrons who are at a little bit higher socioeconomic level. They're not getting hurt by this at all. That the decision we're making right now, the negative impact, is primarily to the lowest socioeconomic, who rely on the library for more than just getting a book so they don't have to buy it, or being able to get Wi-Fi more easily sometimes, or other things. That this is one that I think we've got to revisit when school's open, at least, because we've got a lot of at-risk people who are being sort of let down by us right now, saying your access to information and your education may have to take a backseat to the safety of our staff, which it may be that we may decide that. But I mean, that's just my view of it. That's sort of what we're deciding right now. Okay, so let's take a quick vote. Do we need a motion that we will close the library for in-patron usage, go to curbside delivery effective tomorrow, Scott? Anybody make a quick motion in a second? Please, somebody?
I'll move that we go to curbside delivery starting tomorrow.
Okay, do I get a second? Okay, thank you, Daisy. Quick vote on it. All in favor, aye?
Aye.
Aye. Opposed? Nope. Okay, passes. We're good. Scott, I know you need to run. Okay, so we're going to keep the meeting going just for a few minutes because there are a couple other quick things that I'd like to do. Let's see. We've already talked circulation and things. We're not going to do finance today. We'll cover that at a future meeting. Scott, there's nothing that needs to critically, right? Okay. Facilities, I'm going to quickly ask you on your way out the door, the meeting on the 16th that made up for the pre-proposal, not pre-proposal, the post-bid meeting that happened and everything went well?
Right, that happened, and they extended the deadline an extra 2 weeks to give the vendors more time to put their proposals together. So that went as it was expected, and so far we're just responding to questions from
okay, good. So Scott, that's I think all we need you for right now, but thank you so much. I'm going to bring up a couple of other things. David, I'm going to jump in and just cover governance unless you want to, and just say that you want to.
Right now, council will meet, scheduled to meet Monday, and we are on the agenda, is my understanding. I haven't seen it in writing yet, but we're on the agenda to have them vote on our 4 candidates. So that's all I have.
Okay, and I'm going to go on with governance to say that we are going to keep David and Daisy, if they're willing, up until these new members are sworn in. They need to be approved by the council, then they need to be, as you all know, since everyone else has done this, the clerk has to swear you in. So until that point, we really need to keep enough to have a quorum at least, okay? So I appreciate everyone's, continued forbearance with the city on this. The other thing I will say from the governance side is that I would like to suggest that as we decide on chairman, vice chairman, finance committee, facilities committee, et cetera, governance, that we plan on doing that in the early fall. As our new members come on, that we'll look at those, and that just ask everyone to stay in your existing positions until that point, and then we'll do that. I'd like to have the 3 new members come in, get their feet a little bit wet, and then see who wants to do what. I don't think we're at the point of choosing anyone on those now, okay? Anything else? I have one other thing, but anything from anyone else here?
Yeah, hi, this is Laura. Can I say something?
Yeah, Laura.
Yeah, Scott, I'm sure you're aware, but Virginia is about to, they're about to release they're about to make effective their workplace guidance rules. They're probably going to go into effect the week of July 27th. And I don't know if you've had a chance to review it yet, but there's a lot to it. And I think many of your employees, if you guys are going to be open or opening, are going to fall in that high category. And there's quite a bit of obligations employers need to do then. So you're just going to tell me you're on top of that, right?
Yeah, we got 2 thumbs up, Laura, so that's good.
All right, good.
Okay, real quickly, anyone else? No, okay. Then, real quickly, I'd like to ask both David and Nick to come up. Even though they're sticking around for a while, we have party here for them. Not quite leaving yet. Daisy, we truly appreciate all of the work. Normally this would be a time for a handshake or a hug, but obviously we're not doing that in COVID. So, David and Daisy, thank you so much for all of the work you've done. And that the fact that you've gotten the gift today does not mean that we don't need you for the next meeting. We do. So, okay. Any other things before we close the meeting? Okay, we technically need a motion to adjourn since we're in person. Second? Janet, okay, all in favor, aye, nay? Okay, we are adjourned. Thank you. Oh, go ahead, Chris, did you have something?
No, I'm just saying aye to close.
Thanks, Chris, bye-bye.
Bye-bye.
Okay.